Welcome everyone to today's webinar hosted by Caring.com. Today's presentation will cover the latest advancements in artificial intelligence and machine learning and how they can be practically and safely applied in healthcare. Whether or not you've experimented with AI yourself, you'll walk away with a better understanding of why AI is in the spotlight right now, what the potential benefits are of applying AI in healthcare, while also looking realistically at the barriers for application. Sandeep Shah, CEO and founder of Skyscape, will dive into this cutting-edge technology, and you'll have the opportunity to see AI in action through Skyscape's Buzz Lightning Plus as he demonstrates how this technology can be effectively integrated into daily workflows. We're hoping that all attendees walk away from today with ideas on how you can utilize AI tools to work smarter, not harder. As we begin, I would like to cover a few housekeeping items for today's webinar. First off, this is a one-way webcast, meaning only the presenters will have video and audio throughout today's presentation. However, we'd still love to hear from you. In just a little bit, we will be launching a poll question, so please participate in that. And at any point throughout the webinar, please submit your questions using the Q&A section within Zoom. We will be answering those questions live following the presentation. And one of the questions that we always receive is, will this webinar be recorded? And the answer is yes, we are recording, and we'll send out both the recording and the slides in the next couple of days. Now, this free webinar is brought to you by Caring.com. For anyone joining who may be less familiar, Caring has a portfolio of websites and referral services that millions of people use to research senior living and senior care. Our mission is to help as many seniors and their caregivers as possible through empathetic expert guidance. And thousands of senior living communities and home care agencies partner with Caring to reach their target audience who are actively looking online for care solutions. One of the many reasons that care seekers turn to Caring is for our high integrity reviews program, where we have over 375,000 consumer reviews. Now, my name is Olivia Duke. I'm the B2B marketing director here at Caring, and I'll be serving as the moderator for today's presentation. More importantly, I'm excited to introduce our expert presenter for today, Sandeep Shah, the founder and CEO of Skyscape. Sandeep is a technology entrepreneur. He's an educator and an innovator. He's worked for over 20 years to pioneer applications to modernize healthcare, and he's known for combining vision with strong technical expertise to transform healthcare delivery. I encourage you to connect with Sandeep on LinkedIn, where he actively shares his thoughts and insights on advancements in digital healthcare with a focus on solving modern healthcare challenges for providers and patients alike. I myself have read several of Sandeep's articles on LinkedIn, and it's actually what inspired us to collaborate on this particular presentation today that I hope you all enjoy. So without further ado, I will hand it over to Sandeep to tell you a little bit more about his company and their digital platform. Welcome, Sandeep.
Thank you, Olivia, and good afternoon, everyone. It's very exciting times indeed with all the new developments in AI technology and how we have been operating within the digital health for many years. This has been one of those inflection points. Probably I remember 2 or 3 times in the last 20 plus years that we have been in this space. We are very passionate about healthcare and especially how technology can solve some of the healthcare challenges. Last 20 years or so, we have been working on mobile-first technology that delivers information and knowledge to healthcare providers in the trenches, at the point of care, and that has culminated into a new launch of the product, the Buzz, that we will talk about as a part of the demo of the AI that can be utilized with some practical takeaways. Everybody has heard the buzz, pun intended, about AI in the last 6 months or so, and I'm going to talk about the context of how that can be utilized, and you can have some takeaway nuggets for you to apply in your practice. So see if I can advance the slide to the next one. So quickly, to cover the agenda for today is clearly what the benefits are being seen in healthcare from AI perspective, clearly what the barriers would be, and the challenges, of course, that do present at this stage of the technology. And then what are the practical approaches that you can use today, as I mentioned, and we could go through some demos and opportunity for you to get the technology to drive yourself. And finally, in terms of, especially in the home health and hospice environment where we've been very active, we see a lot of opportunities, especially given the workflow needs of all the staff who works and the patient that have to be treated across the multiple healthcare silos that exist. So how do we work within that environment more effectively and utilize this AI technology? So again, these slides will be shared. So we will just go over some of the highlighted points and make sure that we are able to cover as much as possible in given time. The benefits, what we see is in different parts, across the healthcare spectrum, in different worlds, you can see the benefits that are being deployed and envisioned as we look into this future of the technology. In the hospitals and clinical organization, clearly optimization of all the resources and getting costs under control through that optimization, and also finding how we can improve the care by learning or going through various data that could be parsed and applied with AI to mitigate any adverse events. From the health insurance point of view, although it is a little bit scary, and I will touch upon that a little bit later, there's clearly going to be some optimization in incentives, how they are addressed, and how the claims are handled, whether there is an automation, especially for things like prior authorizations, which is a tricky area, and improve the relationship between providers and how the communication with the insurance industry happens. And finally, the patient population, the most important one, is going to get some benefits from how the diagnosis can be quickly fine-tuned or focused on, how some of the robotic surgeries could be performed, and most importantly, how we can take treatment options and personalize them directly to the patient's individual needs. And finally, the home health. So this is the area where, since the launch of AI within our Buzz platform, we have seen a tremendous kind of excitement as well as feedback in terms of having or co-learning the opportunities and improving and being nimble about what the feedback comes in, so that we can apply those technologies almost on a ongoing basis. So in terms of AI as a technology, has been not new. So the blurb below, you can see that since 95, almost 500 plus different devices, medical devices, have been approved by FDA. And that pace has been accelerating, although it has been there for over 20 years. The last year alone, 20% of those approvals came in 1 year. So this really heralds a good kind of opportunity to save cost in healthcare, almost to the tune of over 300 billion, which is fantastic. So again, everybody who is kind of listening to anything in the news or otherwise know the excitement about ChatGPT, Bard, and other similar technologies that have been released with OpenAI, as well as Microsoft and other players, Google, who are big on these technologies being launched. 6 months ago or so, or late 22, OpenAI launched ChatGPT. And since then, the playground has really helped in terms of learning what it can do and how it can be applied. And this technology is not just limited to these two kind of platforms, but it has been exposed into a variety of environments, including things like Photoshop or Copilot, where development of coding and programming has been supported, and even in terms of image generations, etc. One of the research study that came out of MIT found out that the benefit of technology improves in terms of productivity, improves the productivity of all the users who are in this environment. And that is something, the areas where being able to write and propose different kind of content could be very beneficial, and it improves the productivity for the organization significantly. And this is the approach that we have taken as well in launching the platform in AI. So there is a poll question. Hopefully folks can answer that, and we can fine tune in terms of how the audience has been interacting with these technologies. And while that is happening, I would move to the next slide. And so I mentioned about how the content generation is helpful in terms of what ChatGPTs or Bard can do. So I must confess that there is a temptation that everybody has. So I presented a prompt to these technologies separately to say, prepare a presentation that I'm conducting right now. And it came up with pretty good summary. At the first blush, it will look like it's a great, sort of takeaway I could use. However, I admit, I did not, although tempted, did not use that presentation, but it is a good starting point. And that's the way that these technologies are supporting us right now. And in future, of course, it will improve how it will go about. Let's get to the next slide here. Seems okay, here it is. Limitations. So we guess limitation is at this point, the technology requires a lot of learning. So there has to be a training with the data that has been fed to these technologies, and ChatGPT and Bard have been given the training on older data that has been available on the internet as of 22. So in some cases earlier than that. So it is not live mode, so you cannot really have it parse any current events and utilize that in terms of answers it generates. And in terms of the famous answer by the developer of this technology, Sam Altman, that you cannot rely fully on the generated information through AI. So what good is that? So that's what we are going to learn. And in case of mistakes, as Google found out, then when they did their launch of the demo, there was an answer that was wrong, and it was obviously found out, and essentially they lost about $120 billion temporarily in the market. So in this case, it is financial cost, but there could be bigger costs to be anticipated in the healthcare industry where lives are at stake. So clearly, there is a limitation, and that's the caveat that we have to work within in terms of how we could use this technology effectively. There are three major pillars of the barriers, I would call them. One is that when the technology is obviously not empathetic, it's not, it does not really have emotions, and it can overlook in terms of generated data and statistics and observations. It could miss some of the human touch. So that particular part is a huge problem. And this is something that has been, one of the biggest fears of this technology that has been, bandied about. The second part is, I mentioned it briefly, that inaccuracies that can come about, that is a major issue as well. How do we really take any kind of information and utilize it to patient care directly? And the technology, the answers are so smooth that sometimes you might believe that that's correct. So that's one of the other issues that we have, which is a barrier at this point in time. And then finally, the biggest one is through the the identity and security and privacy risks that are created through this technology are going to have some sort of a unintended consequences in future, especially with respect to the identity compromise or imposter kind of syndromes. So we have to watch out for those as well in terms of how this technology takes shape. And one other point related to the answers generated are what is known as a black box model. So when you ask a question, and we will go through this as we go through the demo. We haven't done that yet. But as certain answers are generated in the current forms of the technology as available purely from ChatGPT or Bard, is that it will not explain where those answers come from. It's going to be essentially an amalgam of a lot of information that has been fed. So you will not be able to challenge, okay, what if, etc. So this is one area that going to cause a concern and problem. The second one is the quality of data. So one of the articles I wrote about, which is utilizing the metrics in medicine, it's garbage in, garbage out. So in terms of data, if the data is not clean or good, it can create fundamental biases. And in her book, Kathy O'Neill, the book has got a very catchy name, Weapons of Math Destruction, WMD, has this misuse of large-scale data algorithms. There have been case studies about in an educational environment how this could be misutilized, and especially in healthcare, where you need to have healthcare equity, there could be a big problem if the data kind of leads you in a wrong path. So that's a biggest kind of ethical dilemma here as well. And finally, the ability to have more privacy-enhancing technologies kind of go counter to models that try to learn everything that has been given. So if you give your patient information or your personal information as a healthcare provider, if that is used for training, essentially it is starting to compromise all these privacy and security issues. So we'll talk a little bit about how we have addressed these three challenges here. And in terms of patient outcomes, we see there are major areas where you can start generating some biggest paperwork or repetitive tasks relief. So mitigating some of the issues that happen with respect to tasks that are mundane and something that you could automate using these AI technologies is a great way to improve your ability to manage patients and help them. And then the fee for service. So as the AI technologies improve, you can provide more value-based care models. So these are typical problems in current day delivery of medicine, that they are fee for service. That means you don't have sort of a incentive to be more value in a given amount of time. And this is part of the problem that can be solved by improving and streamlining some of the tasks and how staff members can operate effectively in a given environment. And again, having an ability to manage large amounts of data, just like the human brain does. This provides a ability to predict certain risks and manage them, especially in large scale cases like pandemic that we just had with COVID. So there are the areas where you could actually get some predictive value out of these AI technologies. And I mentioned something about Buzz, so I'm going to switch over to a demo to show some of the capabilities so that we could learn how this technology can be utilized and what would it do to save you the time and efforts in your environment, especially in home health, long-term care, rehab, hospice or physical therapy type of environments where you have a very fragmented teams and they need to collaborate on a constant basis. So I'm going to switch over to my screen share mode, which
And
hopefully.
And as he pulls up the demo, I also wanted to share some of the results from our poll earlier because we have an interesting split in this group. So, there's about a third of participants use it daily. 26 participants or 26% of participants, they used it 10 or more times. Another 30% have tried it once or twice, and then 10% have never used AI. So I think we have a great mix of all levels. So hopefully you can kind of imagine what using a tool like Buzz would do in terms of AI in your day-to-day.
Excellent. So that's a great kind of a split. And for the demo, it sets the stage for some of the areas where this could be utilized. So, all right. So what I see, hopefully everybody can see the screens here. I have essentially 3 windows here. On the right is a window where one of the care providers, who's an NP, has been established. On the another window, which is a little bit overlapping, but I'll focus on one window at a time, is a physician who is part of the care team and collaborating environment. And on the third window here, which is hiding, I have a phone, so we can look at some of the phone environments as well. So going back to one of the screens here, you see that Buzz environment works in either mobile or desktop environment, and you have an ability to do a variety of tasks. So here is a sort of a console that shows you a little bit of a landscape of what kind of different features are available. It's a platform where a network of providers, healthcare providers, as well as teams and other even patients or family members can communicate fundamentally with a secure environment, HIPAA compliant. Underlining the HIPAA compliance is a major reason to use a platform like this. And also combining all of these interactions and workflow kind of information into a single box so that you are able to get to this in a, sort of almost not to have to use these multiple approaches where you have combination of emails or sometimes text messages or phone calls or pagers and faxes to be separately utilized and not having any kind of cohesive view of anything. So you could do one-to-one communication between providers. You could do providers communicate in groups so that you can form different kinds of groups which are either task-oriented, project-oriented, or patient-oriented. So you could have one group for each patient that you're working on so that you have information that is collected together. And then there is an ability to do workflow with the documents. So you're able to handle the documents, which are PDF or Office or Excel or any kind of documents that you normally work with, can be shared and exchanged easily and opened in the platform and annotated, or you could even send them for signatures right there. And then you have events calendars, so managing sort of schedules. Those could be done directly with the platform as well. So I'm just highlighting some of the areas of integration. Buzz phone, so you have a virtual phone that could be utilized with an ability to call mobile or landline numbers or even receive call back. Ability to send and receive faxes and directed that to the group based on some rules. Location-based services, including electronic visit verifications, telehealth video, so you could set up sessions with patients or family members or have ad hoc care group kind of calls as well, video calls. And then, of course, a whole bunch of settings and customizations profiles as well. We manage organizations so that they are able to have their users within the whole Buzz universe to be connected together and have a more secure kind of within the organization information as well. And finally, we have connectivity to EHR as well. So this is sort of a little bit of high level view. There is also BuzzLink, where you could communicate with patients or families using secure messaging by ability to send them notifications on SMS or emails, and ability to have them connect with your platform on a more secure fashion. So this is sort of a way that everything works. And this is one view of what a user could be connected either through a group. So here is a group which is, there are multiple providers who are connected here, or there could be a single person that could be connected with. So you could have an ability to communicate with, let's say, in terms of say connecting with a physician directly on a one-on-one. So there could be some sort of an information sent here. And this information, when you send it to, say, as an example, the message could arrive on the phone and you could see it on the phone. So just to show you an interaction right on the phone, you could just have an interaction like this, and ability to get different kind of documents, etc. I'm going to focus more, so just so that this base view of this platform is understood. There are individual communication, either one-on-one or with groups, and an ability to connect with different forms of channels, like external channels like video or phone or fax, even SMS. All abilities integrated within one environment, and you see that information always available at any point in time, and there is no expiry or deletion of the messages as you go along. The biggest point that I want to talk about is the Lightning, which is our implementation of connecting with both the AI engines like Bard or ChatGPT, as well as a portfolio of knowledge-based resources that Skyscape offers. So I mentioned that our journey into the digital healthcare space started with working with publishers and content providers and medical societies and nursing organizations to combine a large portfolio of trusted medical information. And this is where you solve the problem of where does the information come from? So you are able to quickly get that information. Let's say I'm here, I'm just showing you a dashboard here that is available to every Buzz user or who would be a provider, let's say. So you could say, I'm just going to search a drug that was something that I need to get a little more information about, in what context it is used. So if I type that, and in an instant, I would get a list of different topics. So these topics happen to be in different books. So you can just imagine that I typed it, and within a fraction of a second, I got Harrison's Manual of Medicine, or ability to get 5-minute emergency medicine consult. These are different resources that are available, and something that as a either physician or clinician, I would be trained on. I know that what they mean. So I want to set in emergency medicine manual, and I want to see that this particular drug that I discussed, what does it say about this in this particular manual? So now you have it within a, literally a blink of an eye, you're able to see this page in the book. And let's say I'm interested in what are the thrombotic disorders into Harrison's, I would see Harrison. So this is the power of integrating information within the context of discussion, or when you want to specifically poll that. And I'll show you how it happens in context within conversation as well. So let's say I want to now switch over to say, okay, I want to ask some questions to the AI engine. So the AI engine, what that means is either it'll be ChatGPT, and in future, there are other engines that are connected with this. We want to get some answers about any kind of medical questions. So use in, so I'm just going to, and I want to provide this information. When I type that information and hit enter or click on the button, you now are actually sending this information anonymized without actually your identity being exposed to any of these engines, or if any other references are mentioned, they are anonymized as well through a secure tunnel. And the information is sent. As you know, there's been heavy load on some of these services, but within a few seconds, maybe 10 to 15 seconds, you get a response back from these services, and that service would provide you this. So I got this information about what this particular drug is used in. And of course, I asked for references. So instead of having a block box, it says that this is Eric Topol is a big name in cardiology, and others these are the papers that were referred, so that now you have exactly an understanding of what can be done with this. So now you got this result. What do you do with it? So maybe you want to send this result to somebody in a group. So I could click on this and say, I want to share via Buzz. In this case, this is more of a treatment option, so you're not sending it to the patient. But if you did want to send it, then you could use the Buzz link, or you could send fax, etc. So let me just say that I'm going to do two things here. I want to save this as a draft here, and I can click on the download, and in an instant, hopefully you can see this window, you would see that this particular information, it put my context here, organization if I was specified, and this information is put together. So if I were to send it to a colleague, or you want to use it in some other mechanism, you could have this information generated right there. Another way to do this is I could potentially share it via Buzz. So I could just say, send it to a group called HankMed, which is a group of bunch of us who, providers who are, discussing different kind of options for patient treatments. And I could send it. And once I do this, so that information would go to this group here. And you see that in an instant, whatever I generated I was able to send it out. And you can see that different providers who are in the group would get that instantly as well on their devices or phone. So that's the power of being able to generate information and send it right away. And if you are concerned, and let's say you want to reference to Skyscape Medical Library, you could use this particular conversation and click on this icon which says Cloud Link, and you say that, okay, here are the different places. So clinical consult or different kind of RX. So you could get the drug information, and you can see the dosing, etc., right in the context. So what does this do is to have an ability to collaborate with providers. Not only that, but also elevates the level of knowledge that is accessible to you on the go. So you are anywhere, you might be at patient's home, or you might be moving from one place to another place in a clinic. You are able to instantly get that information. So that's the power of what you can do with this technology. And again, if I just quickly tap on a few clicks here, I see this particular information. I could even send it by, as I mentioned, with BuzzLink. So once I take that, I'm able to send this to a particular user. So I could type a number, 508-959-93, and patient happens to be John Doe, or maybe a family member. And once you type that in, all this information, and you say that, please find the details, and then you say continue, and it will be sent by SMS. So, so the conversation, essentially a bridge is open to converse with this patient in a, sort of a secure mode, but just by sending them a text message, which would allow them to get this information right on their phone and click on it. So, and if they respond, that message would be also sent back into this particular environment. So with that kind of a background, I think we cover most of the points here. I want to leave some time for questions and answers and maybe draw your attention to anything more based on any questions that might come up. But this essentially allows you to take the information. What we found, I can probably quickly show one more point if I have the screen sharing on just for a second, Olivia.
Yeah, absolutely. Sorry about that, Sandeep. I thought you were wanting to take questions.
Yeah, I want to show one more thing
Okay.
real quickly. So what happens is that you say it's fine, and we are able to allow users to create presets so that items that you do routinely, let's say I constantly I work with a stroke environment and I want to write a stroke discharge notice, I'm quickly able to save that as a preset. So you're able to recall it very easily. And once you hit that, now what you're going to do is that you're going to write a discharge note for a stroke patient. So this is the text that was created. Another valuable kind of a feature here is that the results that come out, as you can imagine, that most clinicians would want to review them. So obviously, it is created for you and you want to make sure that you're happy with it. And once you like a particular format of the answer and you want to reuse it for, let's say, stroke patients or patients who are following certain therapy, you could create what is known as a document template. And in that template, you would be able to sort of utilize it again and again, but you already know that you have vetted this, you have maybe formatted or changed it. So this answer that came in, it is a discharge note, and you see some names highlighted. So in some cases, basically, you are able to edit that and change it, and then you can save it as a document preset, so template document. So once you like a particular format, you can save it as a template document, and you see that this document is generated. You can say this, my stroke document template as an example, and category would be medical as an example. And once I save it, you are able to search for it, and you say, my stroke document template, it's color coded, so you know that this is a document template, and you can use it again and again. You can bring it back and you can change the name of the patient, etc. So that happens to be one of the areas where you could utilize and save time. So for example, here, there is a convenient form here because it had highlighted patient name few times. And let's say you want to put the date here, which was 09/12/2023, and you submit that. You see that everything has been updated in a single stroke here, so that you have this now document ready to be sent. And I could send it, let's say in this case, by a fax. So I have a fax number that, let me just consult for a second, 351-361-7080. And once I have this fax number, this is a stroke discharge. And once I do this, it'll actually create a cover note, and the fax will be initiated. And within a matter of seconds, and you can see this particular fax has been generated, and this is how the fax looks like. And this is an example of how documents can be viewed inline, and you could add a signature if you have to. The recipient can do that as well, by the way, or patients or family members. So you can manage to get the consents. So this fax cover note was created. Your information of the organization is already in there, and whatever information was put in here can be incorporated. So this is a way that you can not only get information instantly, you could use it from a trusted environment, but you could also deploy it or discharge it to a different channels without much effort. So that's how we save time, and we make the daily workflow much more bearable and fun to use. So I will stop here, and Olivia, you can take it over.
All right, great. And it looks like we have some questions coming in already. So please keep submitting any questions that you have. And we'll kick it off with some questions about the Buzz platform. So one question we have is, you mentioned, all of the resources that it's pulling from. Which publishers have contributed content to Buzz?
So basically, world's largest publishers like Wolters Kluwer, Elsevier, F.A. Davis, McGraw-Hill, and this covers almost a collectively, probably 80% of the medical universe, because publishers have consolidated in the last 20 years. But all the famous names like, Harrison's I mentioned, and that pulled it from there. All the 5-minute clinical series, the F.A. Davis nursing guides, nursing drug guide. You have treatment protocols. We have evidence-based series from Wiley, UK. So we even have, constantly updated resources that include all the COVID-related information as well from a society in Finland. So there is a very large aggregation of medical resources from all these large publishers.
Great. And I think that touches a little bit on this other question. Is all of the information peer reviewed and current? You mentioned a lot of aggregated information. How can they know it's up to date?
Yes. So I mentioned that our journey to digital health started with working with these publishers and creating a platform that not only gets information that will be given in a typical book, with reference book, which everybody kind of trains with, and then we have created a digital system to update them constantly. So things like drug databases are updated continuously, even some cases on a monthly basis, some cases it'll be sooner, and certain larger treatment protocols, etc., are updated at different frequencies. But our platform allows that changes to be ingested on an ongoing basis from this publisher. So we have relationship with them, and effectively this is a platform. This is the actual environment with which most of the healthcare providers train with or use them during their learning and days.
Great. And we had another question come through. Do you include any exam prep content? I could see how that would be useful if people need to get certified for different things. Would they be able to access that through Buzz?
Sure. Actually the platform that we have is more sort of a larger platform. We call it Skyscape Medical Library and Buzz, and both have been integrated at the back end or the cloud level. However, we have large number of resources from many of these publishers for NCLEX exam prep, USMLE. So these are not only your traditional books that you read with, but an ability to mark your answers and get feedback. And we have a platform called Skills Hub that allows you to, look at the skills and look at the videos, and you can upload your skills in video so that receptors can check it out and give you feedback.
Great, great. And, we saw in the survey that people on this webinar, they have all different levels. And I'll say personally, I'm one of those. I've used it maybe a dozen times. I don't use it every day, but I've definitely played around with ChatGPT, and, I found some tasks where it's really helpful. For people who are just dipping their toes in, are there any tasks that you would encourage them? You mentioned starting your presentation. Are there any day-to-day tasks that you would encourage people who are just getting started to
there are many tasks, and if you noted during the demo, I had a switch that says medical context or otherwise. So medical context is when you are doing something that would require you to care for a patient, but there are many tasks as even a principal within an agency or somebody who is running day-to-day business as well. There are many tasks that require you to sort of get some information, generate content, maybe post some job posting as an example, or getting staff members, or getting some start of care plan created for patient that you're about to start on your service. So all of this could be done as well. And then, as I mentioned, once you use something on a repetitive basis and you are going to reuse it, you can save that. So within the Buzz platform, so whatever you can do with ChatGPT on its own, it's much better done through Buzz, because now you're able to save that information, flow it to other members, and able to handle it. And in terms of general tasks, I'll just give you one example. Some close associate, close friend of us needs to travel to overseas to meet somebody who is very critical in an ICU, and they were trying to get their passport renewed. So wanted a letter to be generated to give it to the doctor to present it to the passport agency. So this was something that was easily done by just typing in Buzz saying, please generate a letter that talks about this. And then you look through that and you have almost 90% of what you need, and you might edit and you are done. So that saves tasks like on a regular basis, on a routine basis as well. Some of our agency customers have mentioned that they are using it on an ongoing basis for variety of business tasks that they need to cover beyond the patient care. So it's very powerful in that sense.
And one thing you said earlier that really hit home for me, because AI, it's been in the digital marketing space for a while. You know, we have algorithms that are deciding where to show ads, what to bid, all of that. And one thing you said that really hit home was garbage in, garbage out. We have to make sure our data is clean and, you know, everything is tracked. So I think it's really interesting what you're doing here. But one topic that comes to mind is HIPAA compliance. So is everything in Buzz HIPAA compliant? Are there any kind of guardrails when it comes to that?
So everything that is done and sent within Buzz platform is HIPAA compliant. So that includes calls and videos as well. And obviously for any kind of SMS related activities that users can do as a convenience, we provide a big warning if you want to do it as a secure fashion, in which case it doesn't expose the content within SMS, but it sends you a link and you are able to log into a platform to do it. But there are certain areas where we have features where you can receive email into a group. So you could have an inbound email that, let's say you give that particular email inbox to a patient, they can send that email. Once it comes to Buzz, you are able to send it within Buzz environment without any problem. But when it is coming into a general email environment, it'll be a problem. So, but these are the well-known entry points or exit points that are marked and guarded. But beyond that, within Buzz, everything is HIPAA compliant. That's the fundamental basis in which we started it, so that we have a HIPAA compliant product. We don't have to, cancel certain names or use names that don't make any sense, and when sending information by text messaging, which happens a lot these days.
Well, I think that covers our questions for today. So just as we wrap up, Sandeep, would you like to share with how people can get in touch with you?
Yes, sure. So we have our website has a, again, through the QR code or logging into buzz.skyscape.com, you are able to use, your demo request on the homepage, as well as an ability to try this. We have set up this very low friction mode in terms of ability to get hold of Buzz is very simple. As a provider, as a healthcare provider, you are able to start yourself. And if you like advanced features, you could either learn them on yourself using some of the information that is on the website, or you could ask for a demo and we'll be happy to provide that to show much larger number of features than I could show in this particular webinar. However, we encourage you to try on your own, use the Lightning. It is available for all the attendees who are here. So you can use the QR code to get in, and you'll be able to sign up and start using it right away. And we can help you with setting up the agency staff members or others to get full use of this particular environment. There are case studies that we have published that are available as well to give you inspiration about how this could be utilized to improve your workflow. And the bottom lines, of course, and the patient care. There have been case studies that show that Medicare ratings have been increased from as low as 2.5 to 5 by utilizing our platform, as well as reduction in hospitalization that happens, rehospitalization to the tune of about 50%. So this is a huge amount of savings. And as far as staff satisfaction goes, because of the ease of use, we've been commended by principals that this is something that really is helpful. And on LinkedIn, as Olivia mentioned, you could definitely connect with me, and would be happy to kind of give any kind of support that you need.
Great. And so in recapping today's, would you like to share any takeaways with the group?
The takeaways is that I think the technology, there is a little bit of a fear factor, especially with AI. What will it do to jobs, etc. Clearly, I think that's not going to happen. Again, since the early days of technology or even industrial revolution, everybody's worried about their jobs will be taken away. That's not going to happen. You need to retrain yourself and not be afraid of technology, adopt it, use it, and be proficient. There is something known as in AI environment, prompt engineering. So you learn effectively how to create these prompts to AI so that you can get effective use of it. And similarly with Buzz, we provide a lot of thought process in terms of how you could take the best out of technology and be not daunted by it and having an issue. So that's the takeaway. Don't be afraid, use it, and reach out to us. We are happy. We are very passionate to support our user base, and those who are even contemplating any kind of technology adoption would be happy to help you there.
Well, thank you so much, Sandeep, for joining us today and sharing your expertise. And we hope that everyone who's on here was able to get some ideas for where we're headed, where, my mom is a physician, and I remember, 25 years ago when all documents were being digitized in the first place, and the headaches and the pain that people went through in order to go into a digital healthcare world. And now we're at the exciting part where it's really how it can power us for better patient results, as you said. And, that's key here. So thank you so much for giving us that vision and insight and exposing us to what you're doing with Buzz. So thank you so much. Again, if you'd like to get in touch, we'll be sending out these links in our follow-up email as well, if you'd like to try out the Buzz platform. So thank you all so much for joining. We at Caring, we welcome your feedback on today's presentation. And if there are any topics that you'd like us to dive into in the future, we would love to hear it. There is a survey that will pop up as this webinar closes out where you can let us know. And you can also contact us using the phone number and email address listed here. To stay on top of any upcoming trainings, I encourage you to visit our industry website, partners.caring.com. And with that, we will let you get back to the commendable work of helping seniors. And we hope you have a fantastic rest of your day. Thank you all so much.
Thank you. Thank you, everyone.